Dr. Padilla, the issue is social distancing, probably a term you're familiar with. It's May 4th. I would bet that 3 months ago on February 4th, most Americans had never used that term or knew much about it. A little while ago on Fox, the host Laura Ingraham brought this up about social distancing, and I'd like to get your evaluation of it. Let's listen to it together.
I think it probably seemed like social distancing would be necessary. There was no real scientific basis for believing that, since it never been studied. And as one infectious disease doc told me last week, trying to stop this virus with social distancing is like trying to drive a nail through Jell-O. Viruses spread. That's what they do. They often weaken as they go. And if it's like SARS, we hope it is, it'll eventually burn out, as SARS did.
Dr. Padilla, what's your take on that description of how viruses evolve and they spread, and social distancing is like putting a nail through Jell-O? Do we know enough about social distancing to know how effective it is or isn't?
So I'll start with one point. There's actually a lot that's been studied, not just about viruses and the impact of social distancing, but this particular virus and how far it travels when someone is sick and can spread this disease. And even in chances when they're not symptomatic, when they're asymptomatic, how far they can spread this disease. And so I think the social distancing we have evidence on. And do viruses evolve? Sure, they can, but there's no evidence that it's going to do it at a timeline in which is convenient for us to open the economy. I think one of the big travesties for me is, part of what models are, as you talked about, the increase in cases, they're a result of inputs. And the inputs here are us, our behaviors. When states open before they're ready, when we don't follow, public as it doesn't adhere to public health measures, and particularly when they're getting mixed messages about what that public health measure should be. And America's public health agency is nowhere to be found. The CDC is nowhere to be found to help the country move through this safely, more openly, more available to answer those questions, more visible on every venue as it should be in a disaster like this.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.